Since 13th of November 2023, we saw escalation of the conflict in Rakhine state. The townships of Maungdaw, Buthidaung and Buthidaung being cut off from the rest of the, even Rakhine state, like from northern Rakhine was really cut off from central Rakhine, Sitwe. So people were locked out and people were blocked in. We did manage something till end of November, beginning of December with whatever stocks also we had and with whatever freedom of movement, ensuring the safety and security we could. We did something, but then the stocks also started running out and we had no ways to get stocks in for us as well for our teams. And the last strike for us has been closing of Maungdaw and Buthidaung township hospitals. Some have been in the situation of being forcefully shut, and some had to shut down because they ran out of resources. And when I say resources, they ran out of human resource, they ran out of supplies. So, and these two main townships were our only stakeholder, health stakeholder left with whom we could work, and emergency referrals that we were doing, because emergency referrals, you need the referral from the township medical officer to go to either Sitwe or Yangon. So in that sense also we had a vacuum, and that affects the communities. If the township hospital is shut, where do they go? From Rakhine state, it's not just, it's a mix of ethnicities. We have Rakhine, we have Rohingya, we have Hindus. Like in Rakhine, the Rakhinese are citizen of Myanmar, but Rohingyas were stripped of their citizenship in 1982. And now with what's happening in the country with this conscription law, Rohingya are more fearing their whatever freedom, limited freedom they already had being in northern Rakhine. They're fearing that that's also going to be taken off. And Rakhine have been trying to leave Rakhine state and go to Sitwe and Yangon and find refuge somewhere, safety somewhere. But unfortunately, Rohingya staff and Rohingya community members, they do not have even paperwork to move outside of their own village. I'm leaving with that sense that I'm fortunate that I had the opportunity to move, but there are some who are there and they don't have that opportunity to move. So I really feel for that, and I think that thought really consumes me.